This COVID-19 infection control and occupational health Listen to the Experts video series was produced by the CSIR. This video clip was produced in support of the South African National Department of Health in its fight to reduce the transmission and impact of COVID-19 on South Africa's healthcare sector.
Hello, my name is Dr. Helene-Mari van der Westhuizen. I'm a tuberculosis infection control researcher based at Oxford University. I'm also co-founder of TB Proof, a South African-based TB advocacy organization, and we are passionate about using stories and science to improve TB prevention and care. Health worker heroes became a common phrase during the COVID-19 pandemic. And while this appeals to our imaginations, it can also cause harm to think about health workers as heroes. It presents this false choice that a health worker needs to make between either staying home, looking after their own safety, and not helping people who are suffering, or going into a healthcare facility and placing themselves at risk to become infected or potentially really sick with COVID-19. But instead of viewing this as an individual choice that a health worker has to make, it is more helpful to think about this as a social contract. This implies there is a negotiation or an agreement between health workers and society at large. Part of this contract is between health workers and the public. So the public also having a responsibility to prevent the spread of COVID-19 as an illness. The second part of this contract is between health workers and healthcare institutions. Institutions have the responsibility to create a working environment that is as safe as possible for health workers. This includes, firstly, providing PPE that meets quality standards and is available when health worker needs it. Secondly, it means communicating clearly with health workers what the expectations are for them of working amidst a pandemic. Thirdly, it means health workers should be supported with counseling that help them work in these really difficult conditions that is a global pandemic. And fourthly, it should entail compensation should health workers fall seriously ill or die because of this occupational illness. In South Africa, this is not just an implicit social contract, but it is also enshrined in law. According to the Hazardous Biological Agents regulations, they describe what infections are covered as occupational diseases. The Compensation for Occupational Injuries and Diseases Act further stipulates what compensation health workers should receive should they fall ill. And what's important to note is both tuberculosis and COVID-19 are recognized as occupational diseases. This means that should a health worker fall ill with either of those, the burden of proof is on the employer to show that a health worker did not become ill in the workplace, compared to the health worker that needs to show that they got the infection at their place of work. So no, health workers should not be seen as heroes. Yes, they have an incredibly tough job, but they also have the right to a safe workplace. Health workers are not expendable. They form part of the health workforce that performs a very important role in society. By going into work, they are not voluntarily assuming risk, but they are entering into a social contract with society to make their workplace as safe as possible.